Hello, everyone. This is Gary. Today is August 16th, 2021, Monday. It's 6:16 p.m. Eastern Standard Time in the United States in Rochester, New York. I wanted to do a video on electroconvulsive therapy, also known as shock therapy, for schizophrenia and depression, because I had a request to do a video on this topic. Um, Electroconvulsive therapy, also known as shock therapy, is when you're put under general anesthesia and muscle relaxants to prevent bodily convulsions and feeling of any physical pain. And then you are deliberately put into seizures by, well, electricity, essentially. They put electrodes on the left side and right side of your temples of your head, and for a few seconds apply electricity that causes convulsions inside the brain. Um, this is used to treat depression and some forms of psychosis, including some of the psychotic symptoms of schizophrenia. It may be used for other things. I'm not sure. I'm not a doctor, and this is not medical advice. I'm just going based on my own personal experience because I've had electroconvulsive therapy done on and off for the past, I don't know, 15 years, actually longer than that. I haven't had it done in a while, probably maybe 2 years ago, I think it was the last time I had it done. Um, Certain hospitals do it in their psychiatric or behavioral health departments. Not all hospitals do it. Um, I personally have had it done at 2 or 3 different hospitals in Rochester, New York. The first time I did it, I believe, was in the early 1990s at a hospital in Rochester, New York called Genesee Hospital, which actually no longer exists because for whatever reason they had a lot of financial problems and the hospital closed. Not just the psychiatric department, but the entire hospital closed down. They got into a financial crisis or they weren't making enough profit and the whole hospital was shut down. But there's at least 2 other hospitals in Rochester, New York, that, to my knowledge, still do electroconvulsive therapy. That's the University of Rochester Strong Memorial Hospital Psychiatric Department and the Rochester General Hospital Psychiatric Department. And the last time I had it done was at the University of Rochester Strong Memorial Hospital. Um, Electroconvulsive therapy is usually done, well, always done, 3 times a week, on Mondays, Wednesdays, and Fridays. They never do it 2 days in a row. Um, I'm not sure about the reasoning behind that. Maybe it's to give the body and brain a rest between treatments. Um, it is pretty invasive of a procedure like surgery is. I mean, after all, they are putting electricity into your brain and causing seizures. Um, the general anesthesia prevents you from feeling any electroshock or any kinds of physical pain, and the muscle relaxants they use are to prevent actual bodily convulsions. When they used to originally do electroshock therapy back in the 20s and 30s, it would cause bodily convulsions. They did it without general anesthesia, so there was a lot of pain, broken bones, things of that nature. But that's not the way they do it anymore. If anybody's ever seen the movie One Flew Over the Cuckoo's Nest, that's not the way they do electroconvulsive therapy anymore, and they haven't done it that way in decades. Um, and there is scientific evidence that it does help treat severe depression and psychosis when other treatments haven't worked. Um, Back to the schedule. They do it 3 times a week for 3 or 4 weeks, and then they might do it once a month for several months as what's called maintenance therapy to keep the benefits going as long as possible. The only drawback of electroconvulsive therapy is that the positive outcomes are not always permanent. In other words, you might be relieved from depression, relieved from some psychotic symptoms, but the benefits are sometimes temporary. And that's why electroconvulsive therapy is always followed up with evaluation of what kind of medications could be used to continue the positive benefits. Electroconvulsive therapy is often used in emergency situations where psychotherapy and medications and other things just are not working to treat the severe depression, the psychosis, and there may be a danger of suicide or a person just being so depressed they're not eating, they're losing weight, they're just completely apathetic, and they're literally dying from depression or psychosis because they're not eating, they're not getting out of bed, they're thinking about committing suicide, and nothing seems to be working. But if the benefits are temporary, then once the benefits are achieved, then follow up is usually with psychotherapy, evaluation of what kinds of antidepressants or antipsychotic drugs or anti-anxiety drugs that might be useful in keeping the benefits going once the electroconvulsive therapy stops, including the maintenance therapy. And that's been my personal experience. I haven't had electroconvulsive therapy in a couple of years, mainly not because I didn't want to do it, but because I couldn't arrange to have it done outpatient. It can be done outpatient, but you have to have a ride to and from each treatment because the anesthesia, the electroconvulsive therapy itself causes temporary mental confusion, disorientation, along with the anesthesia also causes that. And obviously you can't drive yourself home. You're not even allowed to take a taxi to and from the treatment because, again, you're just too confused. You can't be left alone when you get home. You have to have somebody with you. I live alone. I don't have a ride to and from treatments. It's very hard to even have a friend commit to taking you to treatments 3 times a week, to and from each treatment, and then watch you while you're at home. I live alone, so it's very hard for me to arrange rides to and from each treatment and have somebody at home with me to watch me after each treatment because I would be confused from the treatment and from the anesthesia. So it's very difficult to arrange it outpatient if you don't have the resources to do it outpatient. And I couldn't get into the hospital inpatient if my only reason for being in the hospital was to do electroconvulsive therapy. If you're going to be put into a psychiatric inpatient hospital, it has to be because you're actively suicidal or actively potentially violent. Going in just to do electroconvulsive therapy is not a good enough reason to be in the hospital, at least not the hospitals that I know about in Rochester, New York, that do electroconvulsive therapy. That's considered a waste of a psychiatric bed that could be used for somebody who's actively violent or actively suicidal. So I had a question from somebody on one of my comment sections. Is electroconvulsive therapy something you do for the rest of your life? Absolutely not. That would probably cause brain damage. Now, does electroconvulsive therapy cause brain damage, even if it's just done temporarily? I suppose anything's possible. I personally have not experienced brain damage or permanent memory loss. I've certainly lost short-term memory loss after each treatment. I don't remember going in for the treatment when I wake up. I don't remember going to the hospital for the treatment or being in the hospital for the treatment for like 2 hours after each treatment. But my memory always comes back, and I've never had permanent memory loss for short or long-term memory. So I personally have never experienced that. But I followed up my electroconvulsive therapy with new psychiatric medications. At least they were new at the time. I take Seroquel, Klonopin, gabapentin, which is also known as Neurontin, a couple other psychiatric drugs like Zyprexa for psychosis. I have psychotherapy with my psychiatrist and have medication consultations continuously with my psychiatrist, all as a follow-up once electroconvulsive therapy stops. Now, I just mentioned that I take Klonopin for anxiety. Klonopin is also used for seizure disorders. And so Klonopin is used to stop seizures in people who have epilepsy. So if you're on Klonopin and you're about to go into electroconvulsive treatments, you can't be on Klonopin. They have to take you off of it because the whole point of electroconvulsive therapy is to cause a seizure. And if you're on an anti-seizure medication, that might actually reduce the benefits and outcomes that are beneficial of electroconvulsive therapy. So you can't be on an anti-seizure medication like Klonopin, even if you weren't taking it for seizures. I don't have seizures. That's not why I take Klonopin. I take Klonopin for anxiety as needed. I'm not on a continual dosage of Klonopin because Klonopin, like any benzodiazepine drug, can be addictive. You take it every day for too long, and you get physically addicted to it, and then it's a real bitch to try to get off of it. Especially if you're at higher dosages, like 2 milligrams a day, 3 milligrams a day. I can only take up to a half a milligram a day, and that's it. But if I were going into electroconvulsive therapy, let's say in a week or 2 weeks, I would have to stop the Klonopin ahead of time, 2 or 3 weeks before I started electroconvulsive therapy. The idea being that it would interfere with the benefits of electroconvulsive therapy. There might be other medications that I'm unaware of that you might not be able to take for electroconvulsive therapy. Now, would they give electroconvulsive therapy to somebody who had epilepsy? I don't know for sure, but I sincerely doubt it. It doesn't seem to be something that would make any sense to do that. Why would you cause seizures in somebody who has a seizure disorder? That doesn't seem to make any sense. But that's all I really have to say right now about electroconvulsive therapy. I'm not a doctor. This is not medical advice. I'm only telling you what my personal experience with electroconvulsive therapy, also known as shock therapy, has been, and what I've experienced, and the reasons I went through it. For me personally, the reasons I did it was for my psychosis, my paranoia, hallucinations, and my severe depression, which I take medications for now. And that's pretty much all I got to say about the subject. Like, comment, share, subscribe. If you have any topics you want me to do, leave it in the comment section. This video was done by request by somebody in my comment sections on one of my other videos on electroconvulsive therapy. But like, share, subscribe, leave your comments, and have a good day.